Hi, my name is Avery Clark, and I am a nursing student at Grossmont College, and I am here to demonstrate the proper administration of an intravenous medication. I have everything set up here. This is going to be my patient. This is going to be my saline flush, sterile. This is going to be my medication of choice for the patient's symptom. The patient's symptom is nausea and vomiting, and for that, the doctor has prescribed 10 milligrams of metoclopramide, also known as Reglan. The concentration that medication comes in is 5 milligrams per milliliter. So if I have a dose to be given of 10 milligrams, I have 2 milliliters, as right here. I'm going to ensure that that's properly labeled with the time that it was prepared, as well as the medication that it actually is. And I will ensure that I have my MAR, which is right here. I'm going to verify that the order is actually correct in the MAR. It is. And when in the Pyxis, when actually drawing it up. So I would take my supplies, as well as some alcohol pads, into the room with me. I would enter the room, prepare my area, wash my hands, perform hand hygiene, and ask the patient for their full name, their date of birth, and if they have any known drug allergies. I would ask them if they are currently still feeling nauseated, in this case that they still are. So I'm going to go ahead with this medication. All right, this medication can be given every 8 hours as needed for that nausea. Sorry, every 6 to 8 hours, but I think it's written every 6. Yeah. So I'm going to don, after I've performed hand hygiene and instructed the patient what I'm going to be doing, and letting them know any particular side effects that they may experience as well. That includes sometimes headache, drowsiness, some dizziness associated with hypotension, sometimes hypertension, and some of the classics like nausea, like diarrhea, and constipation. They also may experience some degree of restlessness, so sometimes drowsiness, sometimes restlessness. So I inspect the site. I make sure to see that the dressing that is there is clean, dry, and intact, that the surrounding tissue is non-edematous and no redness or heat is observed when actually pressing. I would observe that the actual site itself is not kinked or damaged in any way. And I would get everything started. So I would take my alcohol swab and brush this area for 15 seconds. Now, 15 seconds is kind of a long time, as well as 30 seconds later on. So I'm just going to indicate that I've done this for 15 seconds. Throw this away. Take my sterile flush. Place it right here. Undo this. And very slowly, initially I'm going to draw back to see if there's any venous return. In this case, there is, so I'm able to begin pushing slowly. During this time, I'm asking the patient if they feel any discomfort or burning sensation to their to their site. As long as there's not feeling any, which they're not, I will continue. And then going slowly, I will administer 5 milliliters of flush at this time to ensure that the site is clear and patent. This time, I would take this, keep it in my hand right here, and then take my medication. Now it's in 2 milliliters, and I can administer it over a period of 1 to 2 minutes. I'm going to do so over a period of 2 minutes. So that's going to be half of a milliliter every 30 seconds. So I'm currently at 2 milliliters. I'm going to administer half a milliliter, nice and slowly. Good. I'm going to wait 30 seconds. I'm going to administer another 0.5 milliliters. I'm going to wait 30 seconds. I'm going to administer another 0.5 milliliters. I'm going to wait 30 seconds. And I'm going to administer the last 0.5 milliliters. All done. And I'm going to wait another 30 seconds at this time. Once that 30 seconds is complete, I'm going to remove the medication and place it to the side and take the remaining amount of saline. And I've completely waited the 30 seconds, so now I can administer the rest of the flush. And then at the very end, I'm going to ensure that it's saline locked. All right. We are done with that. The medication has been administered. I'm going to, at this time, ensure that the patient is aware, once again, and answer any questions and concerns that they have. I'm going to document that I administered the medication, and I'm going to follow up a little bit later, within 15 to 30 minutes, to see how the patient has responded to the medication, if they've had any side effects, and if to see the actual goal of reducing that nausea has in fact occurred. And then I'm all done.